Hello.
Oh, it is recording. I see the little figure. Okay, great. I will do my little spiel and then I'll introduce you. Nice. Okay, here I go.
Hi, I'm Sue from the Southern Mindroom Research Centre at the University of Edinburgh, and we are recording our 10th PsychologiCALL. Very exciting. Today I'm talking to Dr Umar Toseeb from the University of York, and he's going to be talking to me about a paper that was looking at trajectories of prosociality from early to middle childhood in children at risk of developmental language disorder. So welcome, Umar. It's really nice to talk to you today.
Thank you, Sue. Thanks for having me.
Not at all. So I'm sure there's some words in that title that we will want to unpick in a moment, but perhaps you could start by just telling me what your kind of key discovery was, do you think, in this particular piece of work?
Well, what we found was that children at risk of this disorder are on the whole quite prosocial, so they're helping, sharing and caring, and it's not something that they necessarily struggle with. They do slightly worse than children without disability, but on the whole, they're still within what we call the normal range.
Great. So we've got a good news story here about prosociality. So you mentioned there some examples, but could you expand a little bit on what we mean by prosocial when we're talking about that as psychologists?
Yes. So it's quite a broad term, but within our study we were specifically interested in when children share toys or help other children who are maybe upset or hurt, or showing caring behaviours towards other people. And it's a parent report measure, so we ask parents to indicate which of the prosocial behaviours their child shows during a given time point.
Amazing. And so then you mentioned as well these were kids at risk of developmental language disorder, and that's, I know, quite a common condition, but relatively unknown, I think, in the public domain. It's certainly not talked about as much as things like autism and ADHD. So perhaps you could just take a moment to describe what developmental language disorder is and what you mean by children at risk in this context.
Yes, so a developmental language disorder is a disorder where children have difficulties in understanding and using spoken language. It affects approximately 5 to 7% of school-age children, so it's much more prevalent than autism. But a lot of the time it goes unrecognised just because the children might exhibit other types of problems which are not necessarily seen as language, so behavioural problems or other types of mental health difficulties. And the reason why we've called it children at risk of developmental language disorder is because we used the sample we weren't able to do a clinical diagnosis of developmental language disorder. We just used an existing sample, which I'll go and talk about a bit later on. And so we couldn't be sure that these kids definitely had developmental language disorder, but from the measures that we had, we could say that they were at risk of developmental language disorder.
Right, okay. And so tell us a little bit then about what motivated you to be looking at prosociality in this group. Is this something that has been much studied before, or is it quite new territory?
Well, it's relatively new. We know that children with developmental language disorder tend to have poorer mental health compared to children without developmental language disorder. And we also know that prosocial behaviours are associated with better mental health in children in general. So what we were interested in to see whether prosocial behaviours in children with developmental language disorder, how they develop, and whether that development is associated with fewer mental health difficulties. And that's important because it's the first step towards understanding whether interventions focused on prosocial behaviours can be used to reduce the prevalence of mental health difficulties in children with developmental language disorder.
Right. So it's all about preventing mental health difficulties and sort of investigating whether prosociality could be a good target in that kind of process.
Yeah, absolutely. So I suppose with mental health difficulties, there are probably a number of things that can help, and we just picked up on prosocial behaviours because there's some evidence that in the general population prosocial behaviours are helpful, and we were interested to see whether they are particularly helpful in children at risk of developmental language disorder. And I suppose it's more interesting for children with developmental language disorder because because of their problems with using language, they might not be able to access other types of mental health support that are reliant on the use of language. So if we can try and find things or identify things that don't necessarily rely on language that could also help support mental health, then it might be particularly helpful for children with DLD.
Right. Yes, that makes a lot of sense. And so, so tell me a bit about the methods that you use to look at that. You've mentioned trajectories in your title, and I'm wondering if you managed to pull off a longitudinal study, but that's obviously very hard to get funding and resources for. So tell me about what you did.
So we were quite lucky. So we used data from an existing cohort. So that's from the UK-based Millennium cohort study. And what that is around the year 2000, 2002, the Millennium cohort study recruited a representative sample of about 19,000 children who were born in the UK. And then they followed those children throughout childhood. And there were multiple times where parents were asked to complete questionnaires, and children were asked to take part in certain tasks. And what we did was we took the data from the age of 5, so when the kids were 5 years old, they completed a brief language assessment, and their parents were also asked to report on any language concerns that they had about their children's language development. And then we used that data from those language questions to identify the children at risk of DLD. And then we also used the longitudinal data on prosocial behaviour from the age of 5, 7, and 11. So it was the same families that were followed over a period of time. So we did have a longitudinal approach where the same group of children and families were followed over a number of years.
Fantastic. Yeah, sorry.
Yeah, and once we identified the group of children who were at risk of DLD, then we looked to see how their trajectory of prosocial behaviour compared to children without DLD, but also how groups of children change differently over time, irrespective of whether they had DLD or not.
Oh, right. So can you tell me a bit more about some of the patterns then that emerged from the data?
Yes, so we used a technique called latent class growth curve analysis, which takes a group of a population, for example, and identifies how some subgroups of children change in a similar way over time. And what we found was that there were 4 groups of children, and the 4 groups were stable high. So what that meant was children who started off quite prosocial at the age of 5 and continued to be prosocial at the age of 11. There was a decreasing group, so children who were quite prosocial at the age of 5, by the time they got to the age of 11, they weren't so prosocial. And then we had an increasing group, children who were relatively prosocial at the age of 5, and by the time they got to the age of 11, they were highly prosocial. And then we got a group that was consistently quite low relative to others, so they stayed stable at the lower end of the prosocial scale. But all of the groups were within, again, what we call the normal range. There wasn't a group that was at the point where it was a cause for concern. They just varied, going up, down, or staying stable within the normal range.
And so I've never done one of those growth curve analyses, but if I have understood it correctly, what you're doing then is comparing the shape of the pathway that the children are following, rather than where they are at 5 years old and where they are at 7 years old and where they are at 11 years old, right? It's all about the sort of the trajectory, as you say in your paper, the kind of journey that they're on. Is that right?
Yeah, absolutely. So it's a data-driven approach. So the models take the data and look to see how groups of children change. So yeah, it allows the children to increase over time, decrease over time, or stay the same. And it's not necessarily looking at age 5, age 7, age 11, but it's the growth or the change as a whole, the group over time.
And so what do you think are the implications for this work? What do you think we can learn from this? I suppose specifically in relation to developmental language disorder, but perhaps also more generally about, prosociality and the development of that in children.
Well, I think for me what's important is we learned that prosocial behaviours are potentially quite important for children with DLD. So So what we found is that children with DLD who are prosocial tend to have fewer mental health difficulties. And if future research can establish that there's a causal effect between prosocial behaviour and mental health difficulties, then interventions aimed at promoting prosocial behaviours might go on then to reduce mental health difficulties. And like I said earlier, it's particularly important for children with DLD who might not be able to access support for mental health that relies on language. So identifying prosocial behaviours as a potential for intervention would be interesting. I think that's the key thing that I would take from the study.
And what about that group of children who have got sort of declining prosociality over time? You know, do you have any insights or thoughts about what might be causing that to happen? I could imagine that there could be maturational effects where, you know, the level of behaviour that is required to be thought of as prosocial when you're 5, you know, the standards rise around you. So those children are not necessarily becoming less prosocial. They're simply kind of staying in the same place while everyone else's expectations move on. You know, do you have any thoughts about who that group is and what's the story behind that?
Well, I should start by saying that was a very small proportion of our overall sample. So that was 6% of the sample who followed that decreasing to slightly low trajectory. And for the most part, everybody else was in the rest of the trajectory. And I think although we didn't look specifically at what that group consists of, what we did find was important, and I suppose I should touch on this, is the levels of prosocial behaviours that changed over time. It was for those children, it's the current levels of prosocial behaviour that are most important for them levels of mental health difficulties, rather than what they did before. So I suppose for that group, who have a decreasing levels of prosocial behaviour, in earlier childhood, their levels of mental health difficulties might be lower, whereas in later childhood, as their prosocial behaviour decreases, their levels of mental health difficulties might also increase.
Interesting. So what do you want to do next? Have you got another Millennium cohort analysis up your sleeve, or are you moving this forward in a different direction?
So I think the next step would really be about establishing causality. So we know that these two things are related, and we also now know that these two things are related to mental health and prosocial behaviour are related in samples of children with DLD, and we've looked at it in a particularly young age group. So the next step would be to establish whether increases in prosocial behaviour lead to decreases in mental health difficulties. And of course, ideally, we want to do some sort of randomised control trial, but I feel like we're quite a bit away from that, and I think we just need more research to really try and understand what the extent of the association between the two, whether it varies for different groups, whether it varies for different language within BLD, different subtypes. And I suppose the next step really would be to carry on using the existing data sets that we have and use some causal inference modelling, some more statistical techniques that allow us to draw more causal inferences before we can do some randomised control trials.
And I think that reveals a really important point, actually, that's maybe worth emphasising, which is, you know, people can be frustrated at the slow pace of translation of research into practice, right? But at the same time, you know, a good, well-powered randomised controlled trial costs a huge amount of money. It requires investment from a large number of people, and especially, of course, all the participating families and young people and so on. And to go into that prematurely before having fully, you know, sort of really ascertain the right target and the right population is really irresponsible. So I think you're right to be taking that sort of step-by-step approach. But I do sometimes feel like this is one of the things that can be frustrating for people outside research, is to sort of see how, you know, incremental our progress is.
Yeah, and I think also what's important there is prosocial behaviour is just one aspect that could potentially be targeted, and I suppose what we really need to figure out is how much of a difference would it make to mental health difficulties in this sample, because it might be that there are other things which are cheaper to or more efficient or quicker or easier to implement that would have more of an effect. So I suppose progressing the research on prosocial behaviour and mental health would be one line, but also trying to investigate the other things that could help as well, so we could have a fully informed intervention rather than one of the aspects that we've been looking at.
Absolutely. So, Umar, that was really fascinating. Before we finish, I always ask people if they've got any advice for any students or early career researchers who might be listening and perhaps, given the global situation, perhaps be feeling particularly in need of some words of wisdom at the moment. So have you got anything that you would like to share with those people in our audience?
Yes, so I would say that if you have a knack for stats, then try and learn some new techniques and develop your skills in this area, because firstly, I just think statistics are just a lot of fun. And secondly, I think if you're able to do analysis over and above like the standard and overall regression, for example, then it probably, I feel like it opens up a lot more doors for you, whether that's employment opportunities, collaborations, or just being able to just get on and use existing data and do some analysis and write a paper, which I feel like helps your career anyway. So yeah, I would say if you're into it and you like it, learn some statistical modelling techniques. And it doesn't have to be anything extravagant or exciting. It's just learning something new that you don't already know always helps.
Yeah, I completely agree. I think that's an excellent piece of advice. And I think as well, it's not just about your own analyses and your papers, but also your ability to make sense of the literature. Because as those analyses become more and more a part of how we're kind of exploring understanding development, you really need the critical skills to understand them and to understand the assumptions that underpin them and how robust the results are and any kind of limitations on them. And that's something where I feel sometimes at a disadvantage, because I don't have super sophisticated stats knowledge, and I don't now have a huge amount of time for developing that knowledge. So, yeah, I think that's a great piece of advice.
And I thought one final thing, one of my previous mentors once said to me, you should try and learn and use a new analysis technique in each paper that you write, which I think is really optimistic, and I just don't do that, and I can't do that. So I try and do it for any papers that I think we could try and apply a new analysis technique to, and in that way it gets you to learn it as well and then apply it in the paper rather than just learn it and not do anything with it.
Yeah, that is a great piece of advice. As you say, it's a bit of a stretch, but it's good to have goals. So thank you so much for your time, Umar. This was fantastic. For anyone listening, you'll be able to find out more about the work we've been discussing by following the links on the podcast page, which is at ed.ac.uk/Salverson-research. And it just remains for me to thank you, Umar, for joining me today, and thank everyone who is listening. Thank you. Bye. Okay, we did it. I thought that went quite smoothly.